you start reading those topics, just don't deviate and do anything else. Once you start reading those topics over and over and over, you will just get to where, it's just the same thing, and that's when you know you're ready.
Right.
So when you start hearing the same thing over and over, that is your exam. So that means you're going to do well.
And I did get my authorization to test today.
Yay!
I'm excited about that.
I did mine today. Oh my Lord! All right, so that means a lot of people are going to be testing soon. So let's speed this up.
Yep.
All right, so welcome back. We're just here 2 hours tonight, so I'm going to mute everybody so we can speed up. So 2 hours tonight, this is domain 5. Usually domain 5 is more of legal stuff. So all the legal issues at work, all of the things that makes you want to just increase your insurance as a nurse practitioner, or decide if you really want to see this patient, want to keep this patient, you're not sure what's going on with this patient. Those are the legal stuff they ask you on the exam. So, but there are some other things too other than that we really need to touch up for the exam. So exam is really interesting. It's just you're not sure what's going to come up on your own test. So I try to put so many things together for a legal class just to kind of help out, help you remember some of the things we need to know. So this is 15% only. So it just feels like it's not a lot, but that 15% can either make you pass or fail too. And it's about 23 questions on the board. So out of that 175 questions, 25 doesn't count. So you only have 23 out of 150 that should count on your test as far as legal principle. So that's really a lot of questions. But one of the things they want you to go over, so this is ANCC review content. So they want you to go over the Bill of Rights. So patients have rights, and we got to understand that patients' rights are really, really important. I had a patient that told me today, if you don't call me back, I'm going to call patient advocate. I said, sure. So patients have rights, and they know their rights, and they know when they need to exercise those rights, and they know when they're in the right spot to just tell you, oh, I know what I'm talking about. But those legal rights, Bill of Rights, legal rights, all of those are the same. So on that, we're just going to look at informed consent. What is it that needs to happen for those informed consent to take place? So what are the things we need to make sure our patients know before they go for procedure and things like that? Treatment options. So these are all ANCC scope of confidentiality, and that's when we talk about release of information, duty to warn, Tarasov principle, ANA scope, and standard of practice. I'm not sure why they have that standard of practice here, but really you can Google that standard of practice on ANCC website, and it's about 10 of those. And those 10, I don't think they put questions from those, but it's just one of those you really have to know what to concentrate on as far as reading. They can make up questions on the ANA scope and standard of practice, and those are just like keywords for the exam. So that's what the scope of practice here. For me, when I looked at it and studied it, I think that's what it's there for. So we can just know some of the keywords you need to study for this domain, because it's a lot of stuff. And then culture is a lot. Cultural questions, you can get up to 10 questions just on culture. So out of your 23 questions, 10 may just be more culture, and that's like only 13 will probably come from either or advocate, patients Bill of Rights. So culture is a really, really huge part of this exam as far as domain 5. So special populations, risk factors, barriers, ethical decision, ethics in clinical decision making. That's another part of the domain 5 that we really need to know what to do. A lot of people that are already working inpatient, you really find this interesting, the involuntary treatment. You're probably used to it, but some people not sure what to do when you have a patient that's involuntarily committed, or when it's an involuntarily committed patient, or when patient come in voluntarily, what do you do? So that was a question somebody threw at me today. It was about somebody that came in involuntary to the hospital, but then decided he wants to go. So a patient shows up and looked around, and all of a sudden they want to go home. Can they do that? Yeah. But it has to be some things that needs to be done, needs to be looked at before you can discharge that patient out. We just don't discharge AMA in psych. They have to have at least, depending on where you are, some facilities will require 72 hours for those patients to really, it's like a risk assessment. So we have to assess risk and make sure that they're not a danger to themselves or others before we let them out of the facility, even though they came in voluntarily. So those are things that we're going to look at as far as skills and least restrictive care. This is another huge part of the exam. So for some questions, you really have to ask yourself, what is this that needs to happen first? So usually for psych patients, you really want to start off least restrictive. Do not put patient on restraint if they really don't have to. So you start really, really slow. You talk to them and see if you can de-escalate wherever the issue is, and then if those doesn't work, you can go up to whatever you want to do. So least restrictive intervention, least restrictive care for psych patients are top priorities for exam. And then patient advocacy. So we're going to advocate for patients too. So educational accommodation, disability, and FMLA. Just filling out the paperwork. There's really nothing really big about the FMLA for exam. But this is just ANCC outline to review for exam, but you really, really need to just make sure that you touch up everything. Even Quizlet. There are so many things on Quizlet already for Domain 5 that really needs to be touched up for exam 2. Those things count, and all of those make up your points on the exam. So we're going to see what we have up here. So this is the test taking strategies, especially for Domain 5. I like to go over this every time I teach, so I can just make sure that you can remember this on your exam. So there's going to be a lot of questions on, that's going to be maybe 1 or 2 or 3 questions on patient advocate. So they'll ask you examples. What are the things we need to do when advocating for a patient? It's pretty easy, things we already do, but sometimes they twist out those questions that it just gets really confusing. Interpersonal collaboration, that's another piece. What do you do? When do you collaborate? Whenever I say, for me, I say whenever you feel like someone's going to take your license away, or when you're not sure if this is what you're supposed to do as a practitioner or if this is against your scope, you collaborate with somebody. And that's exactly how they will actually do it on the exam. Policy improvement, quality outcomes, cultural stuff, a lot of cultural sensitivity, and competency. And just a good one, the one I like most, when you answer questions, and those questions starts with initial. What is the initial thing for this nurse practitioner in caring for this patient? What is the priority for the nurse practitioner? You gotta think safety. So safety is going to be number 1. Initial safety. And then if you use the outbound mnemonic, it will just kind of help put things together. So when you see those initially question, what is the initial thing for a nurse practitioner to do in caring for this patient? First thing to remember or to look for will be assessment. So when they ask you what is that first thing to do, first thing, assessment. So assess before you diagnose. So you gotta see the patient and see what's going on, take histories, and then you come up with your diagnosis, come up with your plan of care, then now implement whatever the plan of care is, and then come back in 2 weeks and reevaluate the patient. So AdPi really works, and there's a lot of questions on the board you really need to use AdPi to answer. So these are just test taking strategies you want to just keep somewhere to remember it. So the next thing on the slide is talks about patient universal bill of rights for mental health patients. So I can tell you there are like 5 questions that can pretty much come out of this. So on the classes, we don't do a lot of questions, but I just talk about those questions, and I refer to what I say high-yield questions on the boards. So when you go back and do the ANCC IQ questions, sometimes it will help you just kind of remember and know what to answer. But on your exam, which is my main focus, I want you to remember every single thing we go over in class. When you put those questions on the board, you're going to hear my voice and you're going to hear me talk about those questions. So the more your thing, I'll just say do your ANCC IQ, use that to practice as many questions as you can. Because ANCC IQ is really, really, it's not like higher questions, but it just helps you to critically think. The questions there for me, I would say it's a little bit harder than the questions on the board, but it helps you think and it helps you put 1, 2 things together. And some questions on there have come up on the boards, but in a different way. So it's really a good resource. So for this slide here, so I want you to remember, make sure you remember everything about patients' mental health patients' bill of rights. So the first one says patients have right to least restrictive alternative. So we saw one of those outline about the least restrictive care. This is where their question's coming from. So that is patient's bill of rights. That's their right. They know it. So for a psych patient, always start off with the least restrictive treatment. Can you treat this patient outside, outpatient versus inpatient? Does this patient need to be admitted, or can this patient be followed up outside? Can this patient do well on just talking to the patient versus giving Ativan, giving IM shots and stuff? So least restrictive treatment alternative will be the best for the patients, and that's their rights. Patients have rights to informed consent. So this is where we all feel patients, mental health patients, they're psychotic, they're not sure, they probably will forget. So just remember, patients have rights. So when it comes to informed consent, they need to be informed. And also, there are exceptions to informed consent that you really need to review for exam. There are questions on there too. Right to refuse treatment. So patients have rights. They tell you, I don't want to take pills, I don't want to take these medications. Do they have rights to do that? Absolutely, they have rights. So that's one of their rights. Patients have rights to confidentiality, and rights to keep their personal items. And the last one usually talks about cultural questions on the board. So you're going to be taking care of this patient, a Hispanic patient or a Native American patient, somebody that had come in with their personal items and they want to keep it. What would you do as a practitioner? Would you take it away from the patient, or would you let that patient keep it? So as long as that question doesn't say this patient is about to swallow this object, or the patient's life is at risk, or we just can't assume on the exam. So if that's a patient's belonging, if that's a patient personal item and they want to keep it, they have rights to do that. So on the exam, remember, you have to honor it. So that Hispanic patient or that Native American patient that will come in with the spirit stick, or will come in with some kind of walking stick, will come in with some kind of personal items, iPad, telephone, watch, whatever. Inpatient, as soon as they hit that unit, you're taken away. Sir, we need to search you. We need to take all this stuff away. You cannot have this on the... No. On that exam, make sure they're letting them keep their personal items. Whatever item they come into the hospital with, they must keep it if they want to. So that is their right. So remember that. So mental health patients have rights to refuse treatment, except in an emergency. So when you get questions about patients refusing meds, what would you do? They have rights. Unless their life is in danger, unless there's an emergency situation at that time that really warrants them not to refuse the medication, unless there's a court order. So that's the time we can say a patient can refuse, or a patient cannot refuse unless it's court ordered. So they have rights to medication.
Can I ask a question? Because I know that when we admit patients into the hospital, that they cannot keep their belongings, but on the boards they can.
On the boards, that is a universal bill of rights. They can. So if they come in with their spirit stick, if that question doesn't say the patient came in with their spirit stick and the patient threatened to swallow the stick, or patient threatened to hurt somebody with a stick, and patient wants to keep that stick, let them keep it. So that's their right. They keep their personal items.
Oh, wow, okay.
Unless their life is in danger. If that question doesn't say their life is in danger, let them keep it. If you take it away, you're going to fail that question.
Good question.
But on the unit, when you go to work and patients come in with their iPad, first thing we do is to take it away and put it somewhere until they leave the hospital, right? This is when we get questions mixed up. What we do in practice and what we do on the exam.
Okay, so I'm sorry, I have a question. So if you're saying that if they come in with the spirit stick, because I've seen that question before, but they are threatening to hurt someone with that.
If they're threatening to hurt somebody with that, that's safety issue. It's not going to be a matter of their rights. That's going to be safety, right? Okay. If that question doesn't say they're going to hurt somebody.
I mean, for others. Okay, gotcha.
Right. Yeah, and even though, it's just one of those questions where the spirit stick could be something cultural for them. A lot of these patients feel like, their treatment, their healing comes from their stick. So you really can't take those away from them. So especially, that's why they type those questions up with cultural stuff. The Native Americans, these people from this culture, they want to keep it because they feel like they've been attached to that object, and they've been attached. Sometimes they feel like their healing is going to come from that stick. So if you take it away from them, you're going to break that, whatever they feel like they're getting, their treatment. You're interfering with their treatment plan too for them in their head. So that's why you need to keep those. So keep it. So as far as restraints, I think this is another slide we talk about restraint. Restraint is really how you question on your exam too. So freedom from restraint. Never restrain a patient unless they absolutely needs to be restrained. So there are going to be 1 or 2 questions on those too. So patients agitated, they know how to manage agitated patient. IM injections, we went over that yesterday. But whenever they go on restraint, how often do you need to see them? How often do you need to reassess and document as a provider? So as providers, we see patients within the first hour, and then we have to do face-to-face within the first hour, and then we document every 8 hours. So there are a couple of questions on the boards just on this slide alone. And then with the Quizlet, we can pull a lot of these questions on the Quizlet and see what they look like. So this is not really something new, but it's just one of those we have to review.
Rangazi, where do we find that Quizlet?
It is on the WhatsApp group.
Okay.
Everybody should have the Quizlet. But if not, I know some people could not download that, and I've been trying to send it by email.
Right.
So if I haven't done it yet, just reminder, send me a reminder.
Thank you.
I know I just remember somebody I said I will, but I never did. So my bad. All right. So this is a slide. There's a lot of questions on the board pertaining to this slide. So let's move on. All right. So the next one is informed consent. So that informed consent is that communication process between the provider and the patient. So usually we are taking care of patients. We are see patients daily, but then informed consent, as far as how you see those on your exam, it's something that needs to happen between the provider and the patient. So patients have right, and they have right to decide whether they need this treatment plan or not. So they have to have that communication process to happen. So an explanation of relevant information that enables the patient or client to make appropriate and informed consent. So it must be obtained by a nurse practitioner before any procedure. And in some states, so another tip for exam, whenever you're answering questions and you're not sure what the state is doing. So some of the things that varies from state to state. Do not just assume what you do in your state. Well, in North Carolina, we do so, and in California, we do so. So when you're not sure, and if it's something that says that has to, that you have to really find out from the state, so the answer would be to check in with the state. So the state, you really have to check in with the state before you conclude. You can't take what you're doing with your state to another state. So some states will require that a nurse practitioner, when it comes to STDs, some states will require that a nurse practitioner notify the sexual partners. Some states will require that you call the patient directly. Some states will require you call the health department. So every state is a little different. Just like the Tarasoff principle, the Tarasoff law. Some states will require you notify that person that the life is in danger. The patient comes in and says, well, I'm homicidal, I want to kill somebody. So some states will require that you notify that person directly. Some states will not honor that Tarasoff principle. So when it comes to those, you really have to check in with the state. Either you're checking with the state board of nursing or you're checking with the state direct. But we'll get to those questions. So nurse practitioner is responsible for ensuring and making sure that those consents are signed. And there is a question about what do we do when patients are cognitively impaired. For our dementia patient, how do we get consent? How do we know these patients can consent, can sign those informed consents? So this is another question where people use what's going on. Like in my ED, you can find 10 dementia patients coming in to the unit, signing their own consent, signing themselves in. And it's just so like crazy. So patients are not. So how do you know the dementia patient can give you consent? If they're able to repeat everything you went over, they can sign their consents. But if they're not able to give you all of those informed consent, they should not even sign those consent. So nurse practitioner is responsible for ensuring that the client is cognitively capable of giving you informed consent before you let them sign those consent. So dementia patients cannot They cannot repeat everything you went over. They cannot sign those consents. Emancipated minor questions. These are patients younger than 18 who are married or parents or self-sufficiently live away from their family. So these patients can sign their own consent? Yes, they can. So those questions, when they throw those emancipated minors, they can sign their own consent. So Federal Law 42 CFR requires that separate release of information needs to be signed for the release of any information on chemical dependency. So that just means if patient comes in with psych issues and chemical dependency issues, they have to have a separate release of information before you send anything pertaining to their chemical dependency to anybody. There has to be a separate release of information for that. You just can't use that consent for their mental health to the chemical dependency. There has to be a separate release of information for that. So these are elements of informed consent, all of the things we go over with the patient before they can actually sign those consent. We have to make sure they know the nature and purpose of proposed treatment or procedure, risk or discomfort and benefits of treatment, risk and benefits of not undergoing those treatments. So if patient says, you know what, we're telling the patient, well, I need you to switch over to Invega Sustainer because this is much better. You're not getting pills every day, blah, blah, blah. We have to explain those to the patient. We have to tell them the risk and the discomfort and the benefits. Okay, these are the benefits, these are the risks, these are the discomforts, and we have to actually tell them what the risks and those benefits if they choose not to. And then alternative. So this is when we go back to domain 4. Is it domain 4? Yeah, domain 4 class where we talked about alternative procedures or treatments. So we have to let them know these are things in case you choose not to. These are your alternatives and things like that. So we have to, as a provider, have those alternatives ready. And then we come up with diagnoses and prognosis. They have to know that. A lot of patients don't know their diagnosis, and it's sad. They go into another hospital. They ask, well, what were you in the hospital for? Well, I don't know. I don't know what I was diagnosed with. So we really need to make sure patients know their diagnosis and prognosis. And all of this must be obtained by the nurse practitioner and documented and put in the medical record. So that's part of the element in case you get that question. And as far as confidentiality, so confidentiality just says patients have rights to assume that information given to the healthcare provider will not be disclosed. So a lot of patients will tell you all kinds of things and say, I trust you now, do not tell my problem to everybody. So we really need to protect patients' rights, but when it comes to things that we cannot, then we have those exceptions to confidentiality. So protected under federal statute through Medical Record Confidentiality Act of 1995. So it pertains to verbal and written client information. Also requires that the provider discuss confidentiality issues with the patient, establish consent, and clarify. Oh, I was trying to let somebody in. Sorry, somebody was trying to come in. All right. So requires that the provider discuss confidentiality issues with the client, establish consent, and clarify any questions about disclosure of that information. Requires that the provider obtain a signed medical authorization and consent form to release medical records and information when requested by the client or another healthcare provider. So confidentiality issues, we just try to remember those patients' confidentiality because it really, really matters. They will test you on those. So let's see. So exceptions to guarantee confidentiality. So there are some questions on exceptions to guarantee confidentiality. So make sure you know those exceptions. So patients comes in and let's say Tarasoff principle. Do we need to break that confidentiality with the patient when it comes to duty to one? Yes, we do. So whenever patients are dangerous to themselves and others, we can break this confidentiality. So these are exceptions when an appropriate person or organization determine that the need for information outweighs the principle of confidentiality. So there was a question on that as far as, you had a patient that shows up patient that was in the emergency room, had a car accident, really, really damaged, not able to provide information. and you are a practitioner caring for this patient, and nobody else has patient's information except you. So do you really need to give out those information to the hospital when it comes to that patient? Yeah, you gotta weigh that risk. So if the patient is not in a position to consent and the life is in danger, you can provide those information to the hospital to provide care for that patient. You cannot withhold those information. So those are things that you really have to think about. Even though a patient has to sign, but then patient cannot. So if a patient reveals an intent to harm self or others, so that's another one that you need to warn. In cases of child abuse, we break those confidentiality information given to attorneys. When releasing records to insurance companies, those are when we can break those. When answering court orders, going to court, state requirement for mandatory reporting of STDs or other things. So these are some of the sensitive guaranteed confidentiality, and this has to be explained to the patient at least during your first visit. You just have to let patients know when you break this confidentiality. Alright. So domain 5, we have a couple of questions. So I'm going to have somebody that wants to read this. Just take that question and read it. So I'm going to mute. There's some background noise.
The first question is training.
I'm sorry. I think I muted you. I mute you guys. Go ahead. Unmute yourself.
Okay. The next question is treating a 20-year-old female who lives at home with his father and siblings for bipolar disorders. Patient's father calls and requested for information about the patient's prescription medications. How do you respond to his request? A. You cannot disclose any information to the patient's father without speaking to the patient. B. You can speak openly with the father because he is a vet security. C. You can speak openly with his father only because he lives with him. You can disclose patient information, patient diagnosis and prognosis only, but you cannot speak with his father about the medication. Do you want to answer the question or just to read it? Okay.
You read it. That's your exam question. So read it and dissect it. Yes.
You cannot disclose any information to the patient's father without speaking to the patient. I go with A.
So a lot of people say A too. So yeah. So this is just more confidentiality issue. We cannot disclose any information to the patient's father because he's not a patient and patient is an adult, 22-year-old. All right. Good now. Thank you.
Thank you, ma'am.
So let's see what the next slide says. So the next slide is about HEPA. So there are a couple of questions about HEPA. So everybody's pretty good with HEPA because we do this every day.
I have a question.
Sure.
In terms of if this is a minor, if the question was a minor, and excuse me, sorry, if it was a minor and you had to admit the patient, I mean,
Admit the patient?
Yeah.
Or let's say the patient was 10 years old.
Yes.
And the patient lives at home with the mom, and the mom calls you for information about medication.
So no, yes, I know your website. Okay, let me give a scenario. You have a minor who lives at home with the mother. Mother doesn't want patient to be admitted. Father wants the patient to be admitted. They're separated. Who do you get consent from?
Well, now you have to see what's going on with the patient. So if you feel like the patient needs to be admitted, then you intervene.
Okay.
So this is when you be a patient advocate.
Okay.
So you can really,
I think
you can really submit anybody. Yeah.
Dr. Ngozi, I was going to say, I think it depends on whoever has the power of attorney on that person.
Whoever has
Custodian.
Exactly.
And
Whoever has the
you
custodian of that
legal.
person. Right, custodian. You have to be the one to give consent on that patient.
So whoever has that patient under the roof, like some states will require you to do a little things different. If the mother has a custody of their child, then the mother goes. But if they both, okay, what if they both have, what if they're both involved in the patient's life and they both have custody of the child?
I think that
there's no part of attorney. So you can't really start going into like too much. They're not gonna give you those crazy questions like that. It would just be for exam. It would just be something very easy, not complicated.
Right.
So don't overthink these questions. Yeah. So, but in real life, what do? You have to go with whoever has custody of that child. If it's a mom, you work with the mom. If it's a dad, you work with the dad, and then you just kind of see other things on the background, who's involved, what's going on with the child. Do you need to get somebody else involved? And then does this child need to go to court and things like that? So you can take it to anywhere you want. But on the test, just think test right now.
I would collaborate with
exam.
patients.
Yes. Yeah. So don't overthink questions on the boards. That's when you're trying to be both NP and psych at the same time. So things about HIPAA. So HIPAA requires patients' private information.
Dr. Ngozi, I have a question, please. Now, if the scenario is this, the minor is about 14 years old and unfortunately has an STD, like you have this patient in your office by yourself, and the patient says, I don't want my parents to know. In terms of confidentiality, what do you do? Or in another case, yeah.
So for
necessarily STD.
Well, if you're talking about STDs, for example, you have to really check in with the state, see what the state requirement is all about. But if it's just, let's say that patient's pregnant.
Right, yes.
14-year-old is
That's a
pregnant.
better one, yes.
So there are a couple of questions on the boards where minors you have to respect patient's confidentiality too. So if a patient tells you, I want to be a boy, don't tell my mom. I want to be gay, I want to be lesbian, I want to be this, I want to be that, don't tell my mom. Are you going to run tell the mom? No. So you have to respect patient's confidentiality, but then you have to know that there's ethical issue that can come out, patient's confidentiality versus parents' rights to know. So that's an exam question. So remember that. So on your exam, let's focus on the exam and know what's going on in real life. There's going to be some crazy scenarios in real life. If a patient, even if it's minor, on the exam, they tell you something, they say, nurse practitioner, this is what's going on. I don't want you to tell my parents. Please respect that patient's rights on the exam. So parents say, I want to be gay, I want to do this, I want to do that. You got to respect that. So, and there's another question that would say, what ethical issues are you facing as a provider? So that would be patient's confidentiality versus parents' rights to know. So does parents need to know? Yeah, maybe that's an ethical issue you have to worry about later. So those are two clues, two exam questions you don't forget.
Dr. Ngozi, would you?
Thank you.
Dr. Ngozi, would you say that then, if it's an issue, then you go back to if it's a safety issue? If it's a safety issue, then that's clear. If it's not a safety issue and it really is not going to change the outcome, then I would say don't get into it. You have to respect the patient's right.
Don't get into it, just leave her alone. If the patient's pregnant, the parent's going to know anyway. They're going to find out eventually. But if the patient says, I don't want you to tell my parent,
You can't
tell the parent.
Right.
So that's really, that's where a lot of people fight over what's right and what's wrong. On your exam, respect those patients' rights. Even if it's a 5-4-year-old. Does it make sense? No, but yeah, that's the correct answer. All right, so
Even if it's a 5-year-old, is that what you said?
well, 5-year-old tells you I want to be a boy. I want to look like a boy. Don't tell my mom. So you're going to tell the mom, your son says I want to look like a boy. No. So if it's not something safety, if that patient's life is not in danger at that time, there's no point of telling parents. So patient's confidentiality comes first on the exam. But in your practice, you do whatever you want.
Dr. Ngozi,
Yes, sir.
you said was it an ethical dilemma? I said
Ethical dilemma.
ethical dilemma. Confidentiality and parents'
Patient's
rights.
confidentiality versus parents' rights to know. That would be one of the answer choices.
Okay, thank you.
Yep. All right. So this slide, I just want to take over. What do I want you to pick up here? The first one. So that's the Haywood one here. So Loretta Ford. I don't know who this. Loretta Ford and Henry Silver. So those two established the first nurse practitioner program at the University of Colorado. So that's just our question there. But then Pete's MP was the first one to come, and then now there's over 205,000 nurse practitioners on board. And then this MP role is built on fundamental core advanced practice knowledge common to everybody. So the first slide, the first bullet point is what I want you to take away from the slide. That's the Loretta Ford and Henry Silver, those two. So on exam, sometimes they mix up the names. They change out Henry Silver, Henry something. Just remember those two names. So this is the ANA codes. So it's a lot, but this is where I think they put most of the keywords on the exam. So it's not like they'll ask you questions about ANA codes on the exam or what it means or what that is. It will just be like they picked up some of the words, some of the exam codes here: safety, patient's rights, advocating for the patient, confidentiality, accountability. So these are all ANA codes of ethics for nurses. So the first one says, well, I'm going to have somebody read it and give me a break. Rose, can you read? You're just reading it. So we need to know those keywords, and I'll tell you what the keywords are. You can unmute.
Sure. The nurse practices with compassion and respect for the inherent dignity, worth, and unique attributes of everyone. The nurse's primary commitment is to the client, whether in an individual, family, group, community, or population. The nurse promotes, advocates for, and protects the rights, health, and safety of the client. The nurse has the authority, accountability, and responsibility for nursing practice, makes decisions, and takes action consistent with the obligation to promote health and provide optimal care. The nurse owes the same duties to self as to others, including the responsibility to promote health and safety, preserve wholeness of character and integrity, maintain competency, and continue personal and professional growth.
Right. So see where thank you. That was really true. So this where for me, there's no question on the board about this ANA codes, but this is just where they picked up the keywords. There's a lot of advocacy questions. There's a lot of things we do with patient safety. So we promote patient safety, make sure that safety is number one priority. We're accountable for the patients. We're responsible for the patients. We make decisions. So these are just some of the things that you get asked questions on the boards. So there's a lot of where you have to collaborate. I think there's another one that talked about collaboration. Let me see if it's this one. Yeah, that's a third bullet point. So the nurse, through individual and collective effort, establishes, maintains, and improves the ethical environment of work setting and conditions of employment that are conducive to safe, quality health care. The nurse, in all roles and settings, advances the profession through research. So a lot of reasons why you get some research questions and scholarly inquiry, professional standards development, and generation of both nursing and health policy. The nurse collaborate. So there are some questions on the board about collaboration. So when your license is just at stake, you feel like someone's taking that license away if you do something you're not supposed to do, then you collaborate. So we collaborate with other healthcare professionals and the public to protect human rights, promote health diplomacy, and reduce health disparities. The profession of nursing collectively, through its professional organization, must articulate nursing values, maintain the integrity of profession, and integrate principles of social justice into nursing and health policy. So I know there's a question about social justice. You know, when we're doing giving back to people, we're giving back to clients that need services, but they don't have those services. So you think about like homeless patients on the street. So they really need mental health care, but they have no insurance. So when we do those things that are needed, or when we provide those services for patients that really need those services but they can't afford it, those are part of social justice. So, and how do you do that? You can do micro or macro level. When you're providing those services free of charge, working with those patients one-on-one, providing your time, your efforts, those are minor. And then when you do it on a macro level would be when you're going through like big organizations and things like that. So social justice question, you're just giving back services to people that need it for free. All right, Deborah, I see your hand up.
I just have a quick question. So when they ask us something like this on the exam, I know they'll like ask the question, will the American Association, will that be one of the answers, or will it be deeper into like each one?
No, you really can't. I mean, there's no question about like what is ANA scope number, like what is ANA codes number 5, something like that. I don't know. No, nothing like that. It would just be all more like, you know, it's already like a scenario or the actual what this means, like collaboration question or advocacy question. So it would just be somebody, it's just like they picked out the keywords here. So it's not like there's a question about, okay, what is ANA codes number 5? What does it say? No.
Okay.
Nobody got time for that.
Right.
That's too much. Yeah, so just kind of read through the ANA codes. I think if you're struggling with what to study for as far as legal principles, do more of collaboration. And a lot of questions on the boards has to do with advocacy. And then most likely advocating will be the correct answer. So we advocating for the patients to make sure their needs are met. So, all right, so let's move on. Let's consensus model.
Hello?
Where are you at?
Is social justice the same thing as pro bono?
Social justice is what?
Is it the same thing as pro bono, like?
Pro bono. You're doing that pro bono, free of charge.
Okay. Is it the same? Would you say they are the same thing, social justice?
Yeah. I can hear you. You say what?
Would you say social justice is the same thing as pro bono?
It's a part. That's when you do it on a macro level.
Oh, okay.
So you can do macro level. So macro is when you're doing that pro bono free of charge. So you're doing that on your own versus you working through somebody to make that happen.
Okay.
So when you give out your time, you go to a free clinic and work for free, work for pro bono.
Okay.
Yeah. So that's social justice. Yeah. All right. So this slide wants you to take away what type of patients do we care for as site NPs. So there has been questions where we're not sure. They give you questions and then it's something Peds NP needs to be doing. So what type of patients really do we need to take care of? So psych NPs are being approved to treat psych mental health patient population from birth to geriatrics. So we take it from 0 to 99, 100, 129, just all go all the way. So just know the kind of patients, the type of patients we care for. That's what the question is. So this is nurse practitioner core competencies. So there are a couple of them, but I'll pick the ones that are higher for exam. So this is in purple book too. They'll kind of list all of this for you. Scientific foundations, leadership, that's quality, practice, inquiry, technology, information literacy, policy, health delivery system, ethics, and independent practice. So questions about independent practice is not, there's no much question on that. It's just nurse practitioners, I think there are a couple of states that have been able to practice independently, not all states. So there are no questions about how many states can practice independently and things like that. So it's just letting you know that's one of the core competencies. But what are really the things, the higher ones, the quality competencies. So quality, probably talked about just seclusions and restraint, and I think we went over that. That is one big question on ethical, 5 full boards. So just remember, when you restrain a patient, how often do you assess that patient? 8 hours. The first hour patient restraint, we must do face-to-face. And then every 8 hours, the provider needs to document somewhere in the chart that patient has been assessed. That is an exam higher question. So restraint is a higher question. So just kind of touched it up. And do not restrain a patient if patient do not absolutely need to be restrained. But if they're agitated, they can be medicated.
So every 8 hours it has to be a face-to-face, or?
No, every 8 hours needs to be documented. The first hour needs to be. But this is when we try to do things like nurses. So nurses document every 15 minutes. And you get that option on the exam. Do you see this patient every 8 hours or every 15 minutes or every 30 minutes? So nurses reassess patients every 15 minutes, but providers will see patients document every 8 hours. Somewhere in the progress note.
So, Dr. Ngozi, I have a question.
Sure.
Just in case you are not on the, let's say you are not on the unit and a patient has to be restrained, and the patient is put in restraint, how soon as a provider do you need to see the patient after the initial restraint started?
You are not the only provider in that hospital. So your hospital has to have a policy. If you're not there, who else needs to see that patient within the hour? So that's hospital. You have to have a policy on that. But patient needs to be seen the first hour. I know my hospital after 5 p.m. we have like on call. So whoever's on call, as far as like for providers, we leave. But then if a patient gets restrained, they call the hospice, and the hospice has to see that patient within an hour. So it can't be anybody, but patient needs to be evaluated face to face. I think that's Medicare. That's a state law. So they have to be seen the first hour.
All right, thank you.
So you're not going to be the only provider in the hospital. Hey, Ms. Joyce.
Could you please bring the previous slide just for 1 second?
This one? Restraint?
Yes. Thank you.
All right. So,
Dr. Ngozi, I have a question, please. The first hour as a provider, you you see the patient face to face, and the next, every 8 hours you document. What are you documenting if you don't see the patient face to face?
Well, hopefully in that 8 hours before you document, you have to see the patient. So hopefully you're seeing the patient before you document. If not, you're falsifying information.
Right. Okay.
So before you, so that just means you have to see patients.
Dr. Ngozi, can you go back 1 slide? I'm sorry I missed it. My head was down writing notes.
What were you doing with your head down?
I was writing notes as you were talking about that 8 hours, first.
Which one you were?
I saw it, that one, I didn't read it. Evaluates appropriate, okay. I wrote that. I wrote it down, but that's funny. I didn't realize you had a slide showing. Thank you.
I'm still here. All right, so let's go. Okie doke. So we talked about that. Policy competencies employs opportunity to influence health policy to reduce impact of stigma on services for prevention and treatment of mental health problems and psych disorders. So there's a question about mental health stigma. So the mental health stigma question, how do we as nurse practitioners reduce that stigma on patients? So we do that by educating the patient, by letting them know, letting them understand their problem, their mental health disorder, their mental health diagnosis and stuff. So we try to reduce the stigma by education. Education will be one of your answer choice. So scholarly activities. So it is important for nurse practitioners to engage in the following scholarly activities: publishing, lecturing, or presenting, preceptorship, and CEs. So this is just basic information. So when it comes to mentoring, so maybe you have a question about mentoring patients, mentoring colleagues. So mentoring is a process in which a more experienced nurse practitioner agrees to guide or support a junior colleague in the role, competencies, and skills. So it's just a bad definition. So you get that question about mentoring, it's just knowing what that is. Requires mutual respect and interactive process of learning. Needs involvement by both the mentor and the mentee in the relationship. So that's mentoring part. Then nurse practitioner as a preceptor now. So providing that role of a preceptorship, a lot of us are already precepting. So you are responsible and accountable for the student and the patient. So there should not be any harm to anybody. So that's the preceptor part. So you have a patient and you go into a patient's room with another student. So what are you responsible for? So we just have to know what we're responsible for. We are responsible for both that patient and the student. Nurse practitioners serve as the care coordinators, collaborates knowledgeable information on programs, services, and resources. It's a little big typo there. Client advocacy. So when it comes to advocacy, just know what the advocacy is all about. There are some questions that you just have to choose the best way to advocate for that patient. So they will give you a couple of scenarios, and then you pick out which is the best way. So when we stand up for patients' rights, empower them to become their own advocates, reducing the stigma of mental health patients, help clients receive available services, we have to advocate to make that happen. Promotes mental health by participating in one or more of these professional organizations. So there are so many organizations that we can collaborate with to make that happen for patients. So ANA, APNAs, ISPN. So client advocacy question, there are a lot of questions where you just have to pick the best way to advocate for patients. And these are some of the examples for advocating for patients. So advocating for individuals, families, and communities is a part of what we do as nurse practitioners. Advocates for things that will reduce currents to health, such as safe, inexpensive housing. So you got to think about patients that are homeless. So when we advocate for them to get inexpensive housing or just to step down from paying that high price fee, that's part of advocating. It's just an example. Nurse practitioners are expected to advocate for the role and value of other nurse practitioners. Can be another scenario where you're advocating for another nurse practitioner. And how do we advocate for another nurse practitioner? By making sure nobody talks down to other nurse practitioners, make sure that, maybe you get in a situation where people are talking really bad about nurse practitioners, you step up. So attending meetings, getting out, showing and telling people the value of psych NPs. Good example, appearing on local TV stations, writing letters, campaigning within your state nursing association for other nurse practitioners to practice to the full extent of their education. That's another way to advocate for fellow nurse practitioners. Attending town hall meetings to discuss and advocate for your patients. Speaking up for patients even when it will cost you your job. Well, standing up for what is right. Nurse practitioner trying to convince the congressman to vote for the bills associated with legislation. So these are some of the ways to advocate for patients or fellow MPs. So continuing with the roles of nurse practitioner, advanced practice nurses have legal and ethical responsibility to the client advocate. So participation in local, state, national, and international health policy activities. Being involved, testifying at a public meeting, lobby, or work with the media to bring awareness to an issue. So we're still talking about advocacy and talking about our responsibility as nurse practitioners, our roles. Case management. So there may be a question about case management, and it's just about definition, understanding what case management is all about. How do we advocate? It's just part of advocating for a patient and part of providing services to patients. Case management is a system. So it's a system of control, oversight, and authorization of services and benefits provided to clients. Consists of coordinating care. So when we have patients, especially our patients that have ACTIM. So with ACTIM, there's a whole lot of questions about ACTIM, and that's domain 2 and 4 together. So with ACTIM, one of the things they provide for patients is to make sure they have a case manager. So with that case manager helps to coordinate their care and ensure they're getting the things they need. So when you get questions about case management, just understanding what the case management is all about. So it consists of coordinating care, ensuring quality outcomes, monitoring plan of care, and doing advocacy. Overall goal with case management is to promote quality, cost-effective outcome. So now we fly into culture. So I said before, you can get up to 7, 8, 9 questions on just culture alone. So when you talk about Hispanic patients, Native Americans, people from Africa, Nigeria, Zimbabwe, all those on your exam, they're going to ask different questions about different cultures. So you may end up getting 7 or 8 or 9 questions on just culture alone on one test. So culture is that totality of learned socially transmitted beliefs, values, and behaviors that emerge from the members' interpersonal transactions. So we can say cultural competency is that ability to understand, to build understanding between people, to be respectful, and open to different cultural perspectives, strengthen cultural security, and work towards equality and opportunity. So, good tip about cultural questions on the board. First, you got to be respectful of other people's culture. That's number one. So, with all those cultural questions, if you can just remember these three things, I'll tell you, you'll pass all your cultural questions. So the first thing to think about cultural question would just be to acknowledge their culture. Do not overlook anybody's culture. So a patient can come and tell you all kinds of stuff. My stomach hurts. I can do this. I've been to different PCPs, and nobody's able to figure out what's wrong with me. So you have to acknowledge the fact that they even came to you and told you about that. That's one of the answer choices. And the other one is to respect their culture. Don't overlook anything. Be respectful. Be open to people's different cultural perspectives. Those mean something to, it may mean something to them, but it may not, to you, it may just sound like they're crazy. And then try to understand that culture bound syndrome. So those three put together, you cannot be close to answering questions on cultures. So being aware of one's own world, having or developing a positive attitude towards cultural differences, gaining knowledge of different cultural practice and worldviews, developing skills for communication and interaction across cultures. So culture, let's see some of the things on Quizlet that we can try to put together on culture. So this slide talked about like treating patients from different cultures, diverse cultures. So you're going to view every patient as a unique person and knowing the potential relationship between clients' cultural experiences and their symptom presentation and perception. So assume that if nurse practitioner becomes more sensitive to cultural issues influencing the client's symptoms and treatment, more comprehensive healthcare can be provided. Then now, what is those cultural bound syndrome? So you get questions about cultural bound syndrome and just identifying some cultures, some things that these patients do that really makes them look like crazy, but they're not crazy. So you can say it's a specific behavior related to a person's culture that's not linked to a psychiatric disorder. So you will get that to where you will define what cultural bound syndrome is on the exam. So be very, very careful. Do not try to judge people's behaviors. Just try to assess and just see what it is that's going on with the patient. So try to listen and try to respect their culture first. So these are some Quizlet cultural questions that we picked up. So there are a couple of them. So the first one says, assess the patient's cultural syndrome. So I just put it away. Quizlet. I didn't change anything. So I'm just kind of trying to see what I can read out of it. So I left it that way. So when you read the Quizlet, you get the whole vibe. And then we just talked about it to make it make more sense. So one says, assess the patient's cultural syndrome, cultural sensitivity. So sometimes those things comes like sleep habits with the cultural bound syndromes. Some patients oversleep. Some patients wake up 2, 3 o'clock in the morning singing. Some patients wake up 3, 4 in the morning like praying. They're not really psychotic. Those are cultural bound syndrome. They can be, for us, we go into like not assessing the patient before we just judge. We jump into judging them. Okay, they're really psychotic. Now they're waking up 3 in the morning singing. Those could be their culture. So it could be cultural bound syndrome. So assessment is that big thing. So you have to assess that cultural syndrome first, cultural bound syndrome. So the second one says patient has a ring on her finger, but the nurse says they can't have it. What would the nurse practitioner do? So it just goes back to patient's bill of rights. Can they come in with the hospital with their ring and they want to keep it? Yes, we have to honor that. So if that question didn't say patient came in with a ring on her finger and threatened to swallow that ring, you leave it alone. Patients have rights. They can keep those rings. They can keep those iPads. They can keep the spirit sticks. They can keep whatever they want to keep. As long as it's their personal items, they have the right. They can keep it. It's part of their culture if they want to. It could be part of their culture if they want to keep it. So if the nurses took it away and the patient became agitated, I'm coming. If the patient became agitated, because sometimes you take those things away from the patient and they just have no choice than to be agitated. So if they become agitated in that process, what do? You educate the nurses on the importance of the patients keeping their own personal items. You educate the nurses about culture as a provider. All right.
Dr. Ngozi, I want to
ask your question.
Is it the same with suicidal patients?
We just call it suicidal. So suicide is a high risk stuff.
So they can't keep it, right? They cannot keep it.
So if a patient's suicidal, then it's safety issues.
Okay.
So if the question doesn't talk about anybody being suicidal or anybody being danger to themselves, and it's just part of either culture or they just want to keep it, remember they have patients' bill of rights. Let them have it. All right. I think there's a lot of those questions on Quizlets and a lot of those questions on like things flying over everywhere. So this patient's daughter brought her mother in for consultation. The patient has been keeping herself in the room for 2 weeks, and she does not speak English. So what would the nurse practitioner do? So we know this is just straight easy. We request for somebody to integrate. So special population cultures, some questions come from special populations. So it could be Muslim patients or Asian patients. So there are some cultures, there are some special people that really need to think about what's going on as far as their cultures. So for Muslim patients, they prefer to be treated by same-sex providers, avoid shellfish or cloven-hoofed animals except camels for some reason, all fang predatory animals, all blood products, and no gelatin, which is big. Take the no gelatin, write it down. No gelatin products. So for Asian patients, no eye contact during assessment means sign of respect. And also they depend on providers to make medical decisions. Ricky. All right. So cultural competent care, these are some of the examples too. Native Americans. So this was about Native Americans. So there are some couple of things. Read up Native Americans. If you have to go on Google and search up things about Native Americans, there's lots and lots of questions on Native Americans. So try to understand their culture if you can. And if you have more information, throw it at me and share with me. So they have, one thing we know, they have increased risk in suicide. And then suicide is emotionally accepted in their cultures. So that's one thing with Native Americans. They love their spirit, the leader, spiritual leader. They usually have a spiritual leader and they love those spiritual leaders. So a patient says, I want to go see my spiritual leader, and that patient is a Native American. Do you honor it? Yes, make that happen. That's part of their culture. Hispanic patient. So this Hispanic patient says he lost his parent. He has been to PCP. His primary care provider, now he has a stomach ache. What would you do as a nurse practitioner? All right, so you first validate. So 45, this patient came to you and said, oh my gosh, I lost my parent and now I'm having a stomach ache. This can be some cultural issues. I think this question is a higher question. It's about this Hispanic patient. Patient has lost somebody. They had a death in the family. I think it was a parent for some reason. Has some somatic issues, has been to so many providers and nobody's able to figure out what's going on. Now this patient came back to the nurse practitioner. So it's just about a nurse practitioner validating and acknowledging that culture. That's all they're looking for. So you validate his experience and provide him care in a culturally competent way or culturally specific way to the patient. So a Nigerian patient. So this was a Nigerian 16-year-old that moved to the United States 3 months ago, now has somatic symptoms. So what will the nurse practitioner do? So nurse practitioner will just provide brief supportive therapy. So this is a cultural issues, acknowledging their experience, providing them brief supportive therapy, or just provide them care in a cultural competent way. And the core values. So for core values, this is just remembering the core values that underline the advanced practice nursing and culturally competent care includes care, respect, and partnership. So this is just all that ties all those cultural questions together. You have to be caring, you have to respect those patients' culture, and then you have to partner with other people to make sure that we coordinate. Nurse practitioner must be respectful of diverse cultural beliefs and practices, partners with the patient to develop care regimen that produces the desired health outcomes within the context of the patient's cultural values, and advocates for the development of culturally appropriate patient care services. So it comes back to what we do. So we provide them care, we respect them. Nurse practitioner reduces patient stigma by education. So we instill hope and follow up with patients' wishes if those wishes are not harmful. So as long as patients are not threatening suicide, they're not trying to swallow those, they're not trying to just jump off the bridge. If they want to keep their items, if it's something cultural, we acknowledge it. Alright, so we can't say that enough. I have a question here about culture. Let's see. Who wants to try it? Unmute yourself if you want to try it.
I'll try it.
Alright, Nora.
A social worker concerned about a Nigerian refugee who seems to be suffering from PTSD since arriving to the United States 3 months ago, referred this man to an African American female psych MP in the community health center. The psych MP built rapport by exploring the values, beliefs, life experiences, and accepted behavior of this young Nigerian man as she seeks to understand the context of his transition to the U.S. Before making any diagnosis or proposed intervention. The psych MP is striving to provide what type of mental health care? Culturally competent care, individualized care, alternative care, culturally specific care. The answer is A.
Cultural competent care. Yep, that's your keyword. So that's a cultural competent care question. Alright.
Okay, Mr. Rosie, why would it be culture specific?
This is not such a cultural specific here. It's just cultural competent care. It's more related to like dealing with patients from different cultures. Specific care, you have to be specific to something. So it doesn't specify that on the question. So you go with cultural competent care. That specific care is just distractor.
Yeah, deception. Yeah.
Sometimes you see questions that have almost the same thing or the same
Sorry,
word.
can you bring the question back for a minute? I'm sorry, I missed that part.
What were you doing?
I'm so sorry. I'm trying to write something down. Okay, thank you.
So sometimes, even a good tip on the exam, sometimes you see questions that almost look alike. You know, you can rule out B and C like right away. But then you're struggling with A and D. So culturally competent care, culturally specific care. Sometimes you see questions that have the same word, but then something just, you have to see what it is that makes more sense.
Okay.
So culturally competent care is the answer.
The answer. Okay, thank you.
Yes, ma'am.
In that one, there is no specific care that is given, so that makes that incorrect.
Yeah, and I chose this question because when we rule this off in the class, you're not going to be able to rule that off on the exam. So you're just going to go with competent care when you see it.
Right.
So there's no section on the exam of culturally specific care. Go with culturally competent care. All right. Research stuff to touch up. Upcoding. So what's upcoding? Well, we're billing her than actual services we're providing. So you see patient for 20 minutes and you're billing for 60 minutes. That's upcoding. So that's a fraudulent practice. So there's a question on that. What is that? Just definition. So RBs, questions about RBs, you just need to know what RB is all about and what they do and what they can and cannot do. So RB established to protect the rights and welfare of human research participants. So one thing I want you to get away, RBs they don't have nothing to do with animal studies. So no animal studies involved. They all do human research participants. They make sure that informed consent is obtained and documented, risks are minimized, and adverse effects are reported, and the risks and benefits are also reevaluated if needed. There will be no animal studies involved. Components of health policy. So remember the 4 P's. This is straight from Purple Book, but it's a high yield. So there are actually 4 P's for health policy, some policy questions. 4 P stands for process, policy reform, policy environment, and policymakers. So process has to do with formulation, implementation, and evaluation, and this is high yield. It's on Quizlet and it's everywhere. So they will just ask you what that process is all about. So remember the 3: formulation. First you formulate your care plan, then you implement it and evaluate. So process is a high yield. Policy reform, policy environment, and policymakers are just key players and stakeholders. But pay more attention to the process. That's a formulation, implementation, and evaluation. That is a high yield question there. So they will ask you that. So some of the Quizlets on policy, I picked up just 2 that are high yield for me. In a quality assurance program, a retrospective audit will involve when we examine the charts. This is an example, one of the examples. Examine the charts of a discharged patient and using specific criteria to determine the quality of patient care. And that's another one that says when research question is treatment based, you will most likely need RCT, which is randomized controlled trial, where patients are randomly allocated to control or to treatment groups. So these are Quizlet high yield. I tell you, there are a lot of high yield stuff on the Quizlet, and we're going to go over Quizlet on the 18th. So I can tell you all of the things to pay attention to when it comes to the Quizlets and exam.
And you'll give us access to the Quizlets? Because I don't think I have it.
Yeah, and I share the PowerPoint. So that one you get the PowerPoint if you want.
Oh, okay. All right.
Yeah, I'll give you the PowerPoint on that one.
Dr. What time on the 18th? I'm sorry.
12 to 3. 12 to 3.
Eastern time, right?
Yes, I'm in North Carolina.
Okay.
Yeah.
Dr. Goz, is this coming up on Sunday?
On the 18th. Can we finish the class first? Yeah, let's finish the class first. And then,
All right, thank you.
yeah. All right, so be very familiar with these definitions. It's just things that sometimes gets a little confusing, but it actually does. Regulatory and statutory dimensions of the NP role. So you gotta know what the statutory law, the licensure, the credentialing, and which one's the other one? And certification, what those are. So licensure is that process by which an agency of the state. So you think about your license. Who gives you your license? So it's the state government. They grant you permission to practice in that profession that you say you have. Also, they prohibit all other people from legally doing or practicing with your license. Credentialing is a process used to protect. So we're trying to protect the public by ensuring a minimum level of professional competency. Statutory law, questions about those just differs from state to state. So they define what nurse practitioners, our scope of practice, what we can and cannot do. Also provide restriction in practice unique to specific state. So be very familiar. These are on Purple Book, but there are high yield stuff that comes on your Domain 5. Certification, with that psych NPs, we know it's only ANCC. ANCC is the only credentialing center that gives certification for nurse practitioners to practice in the psych field. So it's a credential that provides title protection, determines scope of practice, who nurse practitioners can see and cannot treat. So the process by which a professional organization or association certifies that a person licensed to practice as a professional has met certain predetermined standards specified by that profession for a specialty practice. So certification, take away from the slide, is that title protection. Is a credential that provides a title protection, and the only certifying body is ANCC. So that's your takeaway from this. So I'll read this question. So this is how you questions on Quizlet, and most likely you will see that. Who determines the scope of practice for nurse practitioners?
State.
Nurse, state, ANA, or university?
The state.
What's the answer?
The state.
The state. To high yield. Yep. All right. So 1 point. For a PICOT question. So just know what that stands for. They will ask you, sometimes they change out the wordings. PICOT, problem, intervention, comparison, outcome, and time. So just know what each of those words stands for. They don't go in details as far as what this is all about. It's just knowing what is what. Problem, intervention, comparison, outcome, measurement. So just knowing what it stands for. All right, let's talk about this question and see. Let me see who's going to read it. Who wants to jump on it?
I'll read it.
All right, go ahead. Unmute and read.
In a therapy session, a 5-year-old shows the NP bruises on her back and legs. The child also discloses that her mother's boyfriend hits her and tells her to shut up. The NP is required to A. Contact the mother to investigate the situation further. B. Contact the Child Protective Services or similar services in the local community to investigate the child's safety. C. Arrange to remove the child from dangerous situation to protect her. Or D. Take pictures of the bruise and save them in the child's file. We know that's ridiculous already. So, ruling all these things out, the thing that makes sense is that you want to contact we're mandated reporters. So you're going to contact the CPS. You're not going to talk to the mother that might be a victim of DV maybe, and she's going to protect the boyfriend. And you're not going to arrange to remove the child from a dangerous situation to protect her. Yes, that sounds like it's built in B, but B is a more complete answer because secondary action is probably going to wind up being C, but it's really B for ANCC, I think. Your thoughts?
Gee, you are just the best, Lord. I want to be in your class. Alright, now we've already answered this question. We're like, okay, what's next? So I don't think we need to go over this again. Let's move. So just know who you can and cannot report. I think that's probably the other things to get hold of. Know who you cannot report. You have to. We mandate reporters, as you said. So we have to report cases of child abuse, incompetent elderly abuse, and disabled patients. So any of those will work on your exam. Alright, conflict of interest issues. So question about conflict of interest, they will ask you.
What was the last thing you said? You said child abuse, elder abuse, and something else?
And incompetent elderly. Is it incompetent elderly? Yeah, incompetent elderly. Child abuse, incompetent elderly, and what else? Let me forget. And disabled patients.
Okay, so you said, child, incompetent elderly, and disabled. Yes, that's fine.
Okay. So question about conflict of interest. So you may get a question that talked about conflict of interest, and they will ask you to identify which one is a typical example of a conflict of interest. So we know what conflict of interest is all about. When we're doing things we're not supposed to be doing. So conflict of interest is a situation in which a financial or personal consideration have the potential to compromise or bias professional judgment or objectivity. So good examples. You can say apparent conflict of interest is one in which a reasonable person would think that a professional has judgment is likely to be compromised. So when we're just like, this is against what we need to be doing. Types of conflict of interest: relationship with pharmaceutical, medical supply, or insurance companies. When could be in form of money. So money, gifts of any kind, referrals, fee splitting. All those are part of conflict of interest examples. Getting breakfast from pharmaceutical companies to give out their samples to patients. So it may or may not benefit the patient. So there are some questions about conflict of interest. I think everybody should be okay with conflict of interest questions. So Tarasoff principle. So this is another one you really need to think about what's going on in my state. Every state is different. Some states will honor this Tarasoff principle and some states will not. North Carolina does not honor Tarasoff principle. I just found out. So this is a do it to warn. Just pertains only to homicidal patients. So questions may come and it's talking about somebody that's suicidal and they're trying to talk you into Tarasoff principle. So do not go by what your state does. You're going to get the question wrong. So if your state doesn't, whether your state honors this or doesn't honor it, on your exam, there are two things you need to remember. If you get a question about Tarasoff principle, check in with the Board of Nursing first, because every state is different. So this is another one you check in with the state and see what that state requires you to do as a provider. But you really don't wait until somebody becomes homicidal before you start calling Board of Nursing. So it's just intended when you move to a new state, before you even practice, you find out if that state honors that or not. But that's just the exam. Checking with Board of Nursing if that's an option. If there's no option for Board of Nursing, you must notify the potential victim. So it could be a patient from nursing home says, oh, I want to burn this nursing home down. Or it could be somebody from some patient telling you, oh, I want to hurt somebody. So as long as it's a homicidal threat, you have to report it. You have to notify the potential victim. So nursing home, who do you go first? You notify administrator. You do not call police. You do not call 911. If those are your options, you notify the person in charge. So that potential victim. So if it's a nursing home, the victim will be whoever's on top, whoever needs to make a decision or whoever needs to take action. So that's Tarasoff principle. One question on the board on this.
So I have a question. So on the board, do they honor this principle, or it's the answer is check with your Board of Nursing? Because I know in Hawaii we do have this, but I don't know what the board wants us to answer.
So the board wants you to honor it, but if you have the option to check in with the Board of Nursing, you check with the Board of Nursing first.
I get it. All right, thank you.
But if there's no Board of Nursing, you have to honor it. You have to notify that person.
Okay, thank you.
In a situation you see both of them, which one would you pick?
If you see both of them, go with Board of Nursing. ANCC IQ has a question where there's both of them. So the answer was checking with Board of Nursing. So you're checking with Board of Nursing first. And then on the exam, I think they don't have the Board of Nursing option on the exam. So you notify the potential victim. But ANCC, you have to check in with Board of Nursing. Alright. Alright, now you read this question and see if you get that. Go ahead.
Outpatient medication evaluation. First client reports persistent anger towards his former boss after losing his job due to argument and assaultive behavior towards co-workers. The client has been waiting outside the plant in the afternoon, watching for his boss to leave to confirm him regarding his terminated employment. What responsibility does the psychiatric mental health nurse practitioner have in this situation? A. Consult with the State Board of Nursing regarding state law requirement on reporting potential harm. Contact the client boss to notify him of potential harm. Ask the client to sign a no harm to others agreement and document in the chat. Advise the client to stop going to the plant and avoid any contact with his former boss.
All right. Answer.
I would say I have to notify the patient, the boss in question.
Which one?
That's B, because I'm trying to make sure that his life is safe before I contact the board.
You just heard what I said. If you have both options, which one do you go first?
I will go with A, like
Board of Nursing.
Check with the Board of Nursing.
So what if before you finish
told you, you do not need to wait until patient become homicidal. So this is just letting you know you have to. This is just making you understand you have to check in with Board of Nursing requiring you. So if you notify this person and your state doesn't honor it, what do? You get in trouble. The first thing to do is to check in with the Board of Nursing first and see if you really need to honor it. So because we're not sure, the question doesn't say what state you are in. So if the question says you're in California, then we know it's specific to California. We know California honor this, but then there's no such questions like that. So all those questions that differ from state to state is just going to be one general rule.
Yeah, this is one
So this is one of those, yes.
So this question that throw you off in the exam because.
Right, and this is straight from NCC actually. That's why I put it up here so you can remember that.
Hey, Dr. Guzzi, I have a quick curiosity question, a real life question. If you are in your office and you're in New York State, you have a duty to warn. Let's say you don't have the phone number. Can I call 911 and I can tell the cops because now I've exhausted everything I can do? Would I be wrong by calling 911?
Google it.
So you were trying to notify potential victim.
You did the second event.
No,
I'm telling you. Oh, who remember the event?
No, I mean, let's say that, I know that's not a state board question, but let's just say the guy says, you know what, I hate him. He got me evicted. I'm going to go and I got my, I have a gun at home. I'm going to call 911. Would I be in trouble?
Whatever makes you feel comfortable, whatever makes you notify that potential victim. That is my thing. So this is what I'm going to do in North Carolina. If this patient shows up in North Carolina, what I'm going to do, I will call the police and have the patient IVC in the ED. And they can figure it all out. So every state's different. So I can't, you have to also remember homicidal ideation is one of the criteria for hospitalization.
That's right.
So suicidal, homicidal, danger to self, the IVC. So if you're in a practice where you just don't have time to start doing all of those, you don't want to call that person and the patient comes back and kill you tomorrow. Say, oh, you're a telltale or whatever. I will call the police and have the patient obviously in the ED, period.
Exactly.
But on your test, remember guys, know what to do on the exam.
Yeah. Gigi, that's like crisis intervention. So if you can't, you have to call 911 or the crisis hotline. So either one of those. Yeah.
You won't be seeing me on the news.
And if you notify the client's boss and your state doesn't have the duty to warn,
then you're in trouble. Yeah.
You're breaching confidentiality of the patient at that point. And that's a big lawsuit right there.
Exactly.
And I learned, and I actually looked online for my state, because my state is a duty to warn. I'm in New Jersey, and we have, if you exhaust all your resources, then you do call 911 because someone's life is in danger, and it's also a crisis call, as Dr. Ngozi had said. So, you really... You can't lose. I mean, you're not breaching confidentiality if it's not your state's law. You're calling crisis because we have criteria for hospitalization. So it's a win-win situation, and you're helping the patient.
Right. And in North Carolina, there's a couple of lawsuits too pending on some doctors that North Carolina doesn't honor it. So it's just gonna be what it is. But eventually, you think about patient safety. What's safe? So in North Carolina, I just send a patient to the hospital. They meet criteria. So that's what I do.
Thank you.
Yep, you're welcome. All right, so these are ethics of ethical principles. Note this. This will be on your exam. So there are a couple of questions on this. Justice. It will just be a scenario where they give you a scenario what's justice all about. A patient's telling you it's not fair that you're doing something to this patient versus what you're doing for that patient. So it's not fair. Fairness is justice. Beneficence, promoting well-being and doing good. So it will be just more patient scenario, and then you figure out what is what. Non-maleficence, doing no harm. Patient wants Ativan, wants all these medications, it's going to harm the patient. Patient may be pregnant. You're like, no, I'm not doing this. What ethical principle is that? Non-maleficence. So these are easy if you know what it is. So just memorize this: fidelity, being true and loyal; autonomy, doing for self; veracity, telling the truth; patient wants medication, injection, and you tell the patient, oh, this injection doesn't hurt, and patient gets it and it hurts. So what ethical principle did you just break? Veracity, you didn't tell the patient the truth. Respect, treating everyone with equal respect. The patient wants to be called Gazi, and you're like, hey baby. So treat everyone with respect. They will ask you questions about all of this. What is what? Which one are you breaking? Which one are you not doing well? Which one is what? So know those ethical principles. You'll get 2 questions on the exam on those. But all of them are on the exam. So depending on what exam you're getting, you may just get 2 minimum or 3. Some people have gotten 3. I think I only got 2 on mine. Alright, important ethical principles in psych. So this is when clients must be involved in decision making. So a lot of times we try not to involve patients with decision makings. That's wrong. So every patient must be involved in decision making to full extent of their capacity. So mutual decision making. Patients have rights to treatment in the least restrictive setting. Especially, questions about least restrictive setting on the exam talks more about dementia patients. So dementia patient gets agitated. What do? Do you inject? Do you give IM Haldol for a dementia patient that's agitated, or do you just try to take the patient to a quiet area? So what is that least restrictive treatment for that patient? Clients have right. Yeah. So clients have right, and on the exam, make sure you're not prescribing or giving a dementia patient antipsychotic. So clients have right to refuse treatment unless a legal process is involved or unless there's a mandatory court order. So these are important ethical principles inside. Ethical dilemma occurs in situations in which there are 2 or more justifiable alternatives. Occurs when a choice is made to promote good, which option sacrifices the fewest high priority values, a harm to reduction approach. So this ethical dilemma may come in form of your patient, like a 4-year-old, 5-year-old, 10-year-old, tells you something. It's like, I don't want you, I won't be this, I won't be that, do not tell my parents, do you honor it? But then that's going to be ethical dilemma that will come out of it. So that patient's right versus patient's confidentiality versus parents' rights to know. So ethical dilemma is when we struggle with what to do. Alrighty, there's a practice question. It's not going to be Gigi this time. Let it be somebody else. Gigi, I love you.
I know.
Valena, can you read it? Let's hear from Valena. Miss Valena?
Yes, ma'am.
Let's take a break from Gigi.
Okay.
Go ahead.
As a nurse practitioner on call for behavioral health unit, you receive a call from the unit that a 78-year-old female patient with the dementia has become agitated and combative and has attempted to hit other patients and staff caring for her. What would be the most appropriate initial intervention? A. Order a 1 milligram of Haldol and a soft bilateral restraint until you can evaluate the patient. B. Order a short-acting dose of Ativan, 0.5 milligrams, and move the patient close to the nurse's station until you can evaluate the patient. C. Order close observation by staff in a quiet, secluded area from the other patients until you can evaluate the patient. Or D. Order a soft and vest restraint. I can't see this part. Until you can evaluate the patient. I'm going to go with C.
C. Yep. So we talk about the least restrictive intervention. So which will be the most appropriate initial intervention? All right. Correct. Everybody agrees to it? So C, you provide close observation first before you go into more intervention for the patient. So C is the answer. So due to patient's frailty, limited risk to inflict real harm, increased fall risk if sedating medication used, and potential increased agitation is physically restrained. So the least restrictive approach is to provide close observation in a secluded, quiet area until the nurse practitioner practitioner, there's a typo, until the nurse practitioner evaluates that patient or that evaluation is completed. Alright, so things about Medicare. So know your Medicare. There may be 1 or 2 questions on Medicare, what they cover. So there are 4 types, 4 parts of Medicare, A, B, C, and D. So each of them you have to really know which one covers what. So this question says which part covers physical therapy, occupational, and speech therapy. So we know that's what somebody typed up. Answer A. What part? B, C. So I know A is inpatient, B is outpatient, C is optional, and D is drugs. So part B will be physical therapy. That's number 3. Yep. So A is inpatient, B outpatient, and outpatient covers ambulatory services, PT, OT, speech therapy. C is optional coverage, and D drugs, drug pharmacy. Alright. So high risk patients for suicide, like we went over last night, patients that are really, really depressed. Major depression should be priority. And for those patients, we always think about safety. So male gender patients have high risk for suicide, alcohol use disorder, previous suicide attempts, Caucasian race, history of violent behaviors, Native Americans. So if you get questions or talked about any of these patients and they want to know who has the highest risk for suicide, so you can count and see which one has the highest risk. So a patient that sounds like 45-year-old Caucasian male with alcohol use disorder and history of violent behavior, also live in Montana, that's probably a high-risk patient. High-risk suicide patient. For homicidal patients, on your exam, intermittent explosive behavior will be the highest risk. It takes in decision making. So there are a couple of terms to review, like commitment. So we gotta be very familiar with those words. You know what it means, what we can and cannot do when it comes to these patients. When we commit a patient, we're forcing that patient to get help. So some patients may not be willing to go in for treatment, but you have to commit them regardless. So questions about commitment and patients on the exam, think about anorexic patients. So those patients will make criteria because they feel like they're not sure. And a lot of times there will be resistance to going in patient. So you saw that patient came in, BMI was less than 16, patient refused to go in. What do? We have to commit that patient if they refuse because they meet criteria. And also think about criteria for admission for involuntary treatment. Before you involuntarily commit somebody, they must meet criteria. So DTS means danger to self, danger to others, or they unable to care for themselves. Voluntary patients, they decide to go in by themselves, they need help, they're suicidal, they just need that help. They go in by themselves. And if that voluntary patient shows up and decide to leave, as long as they've been admitted and they decide to leave, we do not AMA patients, just like medical patients. Patients say, I want to leave. All right, sign the AMA form and leave. Choose out. For our side patients, if they come involuntary and they decide they want to leave, you have 72 hours. You have to complete what's called risk assessment on those patients. And you have, depending on what state you are, you have up to 72 hours to decide in North Carolina if that patient is safe to leave. So they just do not sign out AMA and get out. So you have to assess that patient before they leave. But if they're involuntarily committed, they cannot come and leave as they wish unless there's a court order, unless a judge demands they leave immediately. Least restrictive care, I think we talked about that. Those are some of the decisions we need to make in the clinical setting. Disability Act, just remember a lot of times what this is all about is just sometimes they will change out the year. So they'll give you our American Disability Act of 1940, 1950. So remember the year, actually, because pretty much everybody knows what that is. You cannot discriminate against individuals with mental health disorders in employment decisions. And also, the law mandates that reasonable accommodation need to be made for those individuals. And those includes adjustment to a job or work, such as modifying work schedules or reconstructing a job, and FMLA. So, any questions on those? going. So notice stack law. So stack law, that's one of the things to review. Parity law, telehealth. So know those words. Stack law means when you refer patients to your family members. Refer patients to providers you know for financial gain may not be in the interest of the patient. Parity law requires that any annual or lifetime limits of medical and surgical benefits be the same for mental health patients in substance use disorder benefits. So that fairness. So if they pay $20 copay for medical, they pay $20 copay for mental health services. So stack law, parity law, know those two. And then kickbacks. So there's something I shared on WhatsApp about kickbacks. So there is a question about stack law and kickbacks. So know which one is what. Be able to identify which one is stack law and which one is kickback. Kickback means when you're collecting money. So when there's money exchange, that's bribery. Telehealth. So questions about telehealth, checking with Board of Nursing differs from state to state again. So we gotta see what each state does and does not cover. Find out laws that covers your responsibility and legal liability. Must assure that HIPAA regulations regarding confidentiality and maintenance of health records are followed. Must follow same standards of care as in person. Must be practiced in accordance with international, federal, and state regulatory agency standards. So, staff law, telehealth, parity law, those are the main 5 questions. Court cases. So, you may or may not get questions about court cases. I did not get any on my exam. Some people have gotten 1, 2 on their exam. So, court cases is one of those to review. O'Connor versus Donaldson just rules that harmless mentally ill patients cannot be confined against their will. So if these patients can be maintained, can live normal in the outside ward, they do not need to be admitted in the hospital. So determine that the presence of a mental illness alone cannot just justify involuntary hospitalization. Dusky versus United States is a competency rule. Durham versus United States is sanity defense. So you gotta remember all this. Those are on your exam. So Durham, United States, insanity defense. Patients, and this is when you think about patients when they're manic. So manic questions on the test will require that you put this patient in the hospital. Always think safety with manic patients. If they hurt you, they can plead insanity and they get away with it. So Rogers versus Alkin, patients have right to refuse treatment, to refuse medication, But then if they have a guardian, the guardian can consent them for treatment. Rainey versus Klein determine that patients may have rights to refuse any treatment and also use an appeal process. So some people have gotten to where they just have something to tie with days to help them remember it. So if you have something that helps you remember in your days, it's absolutely fine. But you have to, for me, when I took my boards, the Rainey versus Klein, I thought about Calvin Klein. So I said, well, he's rich, he's popular, he probably can refuse any treatment and just get away and still come back and appeal for it. So that's how I remembered it. So it just stuck in my head since then. So Rogers versus United States, find something to help you remember it. Alright, got a practice question. We're almost done. I think this is the last question, I think so. So who wants to go for it? Let's see. It's Dorothy.
I can read it.
Okay.
Alright, go ahead.
Mrs. Smith, can you all hear me?
Yes, we can. Go ahead.
Mrs. Smith, a 45 years old female patient who is involuntarily hospitalized, is experiencing psychotic symptoms and has refused to take her ordered medication because she believes that Jesus Christ told her to fast and therefore should not take medications. Your action should be based on your knowledge of which of the following. A. Psychiatric patients do not always know what is good for them. B. Psychiatric patients cannot refuse medication. C. Psychiatric patients can refuse medication. D. Psychiatric patients cannot make
good decisions, and therefore the NP should use her best clinical judgment. I'll say psychiatric patients can refuse medications. Finally.
Okay. They can what? What's your final?
C.
All right. They can't refuse medication. Correct. All right. So this is the last slide. You gotta remember this guy on your exam. So this is petition for right of habeas corpus. So what is this? So you gotta understand what it's all about. So this also applies to involuntary patients. They go in the hospital, they feel like someone committed them against their will, they can appeal for it. So they have right, they can get a lawyer who can represent them, and they go in front of a judge, this judge, and the judge decides if what happens, if they leave or go home. So this is habeas corpus, so just know what that is. So legal request for release from facility or an institution that a patient can file for himself or herself, or with the help of an attorney to advocate for himself. So if accepted, the right will entitle the patient to a hearing in a superior court. So patients have rights and they can appeal. So habeas corpus is on the test, so just know what it is. Can also be applied to patients in prison. So if they feel like they've been detained against their will, or they just feel like something's not right, they can appeal for it too. So this judge, just have a picture of him in your head. It will show up. You will see question habeas corpus. Alright, and this is where we stop tonight. Thank you guys for listening. Ooh, that's a lot of information, right?
Thank you, Dr. Gauzy.
Yes, ma'am. It was a lot of information. So come back next week if you still need some more information on this. So I will go over it again on Thursday next week. But I will.
When is our next class?
Monday.
Okay.
Monday we're going over domain 1 and 3, and then Wednesday domain 2 and 4, and then Thursday domain 5. So we go over all the domains every week.
Okay, but we still have the last minute review on the 13th, which is.
So I do last minute review every Tuesday, but it's only a one-time class. So I usually recommend that like a week before you test. Okay. So just a wrap up of everything in like a really nice 4-hour class. So when you're ready to test, you have your test date. A week before your test, you schedule. It's a one-time class, so it just helps you think and focus more. But once you're comfortable with all the classes, you should do well. So it's just trying to wrap up and say, hey, remember this, and just things like that. But it's a really good class. It's very highly recommended. Yes.
Thank you. This Sunday is what's going on the 18th?
This Sunday is you relaxing on your own and reading on your own.
Oh, okay, that's right. So what's happening on the 18th?
18th is the Quizlet review. It's a 3-hour Quizlet review. So we're trying to put all the Quizlet things together. There are high yields that people have found very helpful in their tests. I would strongly recommend you go over that Katrina's Quizlet note. I didn't know my camera was off. So that Katrina Quizlet, I will repost it again. For some reason, it doesn't download on some people's phone. So that Katrina's Quizlet is really high yield. She updated her Quizlet from my class because I was teaching and she was just typing it. So a lot of things that are not on regular Quizlet, she updated on that one. So I highly recommend that. It's like just my class.
And you'll give us access to that?
And I'll give you access to the PowerPoints if you want for the Quizlet.
And
so whatever we use on the Quizlets.
And that's at 12?
12 to 3 p.m.
Okay, so I'm going to be having coffee because it's 6 o'clock in the morning for me.
Eastern time. Well, by the time you're done with the class, you're ready to start your day. So don't worry.
It'll be fine.
Can you repost?
That's all I'm asking.
Yes.
Is the Quizlet free? I mean, do we have to pay for that?
No, you're already in the group. You don't pay for it.
All right, thank you.
So if you're already in the group, you don't pay anything else.
Okay, Ngozi, are you going to repost that Quizlet?
I will try to repost it. I'm trying to see if I can, because I think because I've shared it so many times, it doesn't download anymore on people's phones.
What is the heading of it? What is the heading, please?
It says Katrina's note.
I don't have that.
I don't have that.
I don't have that either.
I don't
There's
have
an
that.
issue, Dr. Ngozi, there's an issue with the latest update for WhatsApp. That's what it is. That's why a lot of people can't download it.
I'm not sure. It downloads on my phone, and I just every time I click it, it just opens up, and I look at it and read it. So I'm not sure why people are having issues. But if you don't have it, I'll repost it again. If you can't, just text me your email.
I have a quick question.
But usually, if you sign up through the website, you should get it. You should already have it if you sign up through the website.
On WhatsApp, we post many times, post many times, you will be able to download it.
Right. But if you sign up through the website, when you registered, you should already have it because you get email. And that email has that Quizlet.
Dr. Ngozi, so the only thing we need to sign up for then is the ANCC testing site and to get those questions in this class. Is that it?
Yeah, the ANCC IQ questions.
Yeah, you have to pay for that
you
separately.
can get those. Yeah, you can get those. Those are usually like 125.
Yes.
Yeah.
Right. But if you don't need the CEs and you just need the credit, you just need to answer questions, I can give you access for like half price.
Okay. All right.
You can go to Nursing World to get
You
that.
can go to Nursing World, but that's 125.
Yeah, I already did it.
Ugh.
Okay, so those are the only two things that we
All right.
need to
Just
separate.
text me if you need it. Text me.
Dr. Ngozi, I just have one quick question. With the study group, can you give me some guidance? Like, I don't want us to be all over the place. Like, what kind of format? I mean, how do we? Because I have several people that request that they want to be my study buddy, but I just want to know what can you inform to how to go about it?
You should just say yes to people.
No, I know. I mean,
And then when you meet with that person, you figure out you're like, I don't want to get it. I don't want it anymore. I'm out. I have an appointment. I can't do it anymore. I don't know. I don't know the answer to that. But I know a lot of people have good resources on the Study Buddy. I would recommend anybody. I would study with any of you.
Hey, Dr. Ngozi, please, is the 25 out of 25 and 5 pages, is it different from the Katrina's Quizlet?
Right. It is different. That one, there's a highlight. There's a yellow highlight and a purple highlight. I think so.